So your neurosurgeon may have suggested to you that an endovascular approach is the best way. What are some of the things that we're doing during these endovascular approaches? First, we bring you to the angiography suite, which you are likely already familiar with. Under general anesthesia, with you fully asleep, we bring up the small catheters or tubes so that we get right up next to the aneurysm. This is a little bit closer than we were when we did the diagnostic angiogram, but this is where we need to be in order to block off the aneurysm from getting any blood flow. There's a couple of broad categories of how we can treat things from within. One is by placing little devices into the aneurysm and blocking the blood flow. Most commonly, and for the last 30 years, the most well-defined is coils. These are little fibers of metal filaments that are different sizes, shape, and stiffness, but can be placed from within the catheter into the aneurysm, thereby filling it up and packing it tightly and not allowing blood to flow in. Sometimes it can be tricky to get these coils to sit exactly in the aneurysm and not block normal blood flow, and we'll use other devices like a balloon to hold it in place temporarily until it's very nicely filled, or sometimes a permanent stent, which we leave in place to always hold that coil mass up in the aneurysm and preserve the normal blood flow. However, in the last 15 years or so, we've also had new technologies. In particular, we have a technique where we do what's called flow diversion. And this is where we actually place a stent without necessarily putting anything into the aneurysm. This stent is a tighter mesh than other stents can be, and this reduces the blood that flows into the aneurysm in a dead end fashion and preserves the flow in the normal vessel. Over time, this stent has new blood vessel cells growing on the inside, and it essentially forms the scaffolding of a new healthy vessel. It's important to know that there's always new technologies being developed for endovascular techniques, and these are coming out every single year and are always being studied for challenging aneurysms that we can't effectively treat with endovascular techniques just now. That being said, many of these devices, including flow diverters, haven't been fully and specifically tested in children. So ultimately, the use of these devices in some ways is always uncertain compared to their use in adults. Sometimes though, endovascular techniques are not going to be a safe and effective way to treat your aneurysm in a durable fashion, and it may be more appropriate to treat it with an open surgical technique, which I'll talk about in the next video.